Hi, Rebecca.
Hi.
Heather.
Hi.
Hi.
Welcome. Thank you guys so much for being willing to come on this Facebook Live stream event. I know there wasn't a lot of notice, but I really appreciate it. This is Dr. Maria Sophocles, and we're doing another great episode, I hope, of Gynecollege, where we delve into women's healthcare topics that women of all ages want to know about. So we talk a lot about menopause, about sexual function, about getting older, about pain and bleeding. I thought tonight we could talk a little bit about contraception, about birth control. And well, we all know that it's not just for contraceptive purposes. We also know that it's used in women from teens to midlife. So I thought it'd be nice for the three of us to have a little chat and even to get a couple of non-clinicians in to ask us some questions that we could answer. Let me introduce you both to our listeners. Dr. Heather Gibbons is a board-certified OBGYN with many years experience who trained at Emory and at Dartmouth and is now joined Women's Healthcare of Princeton. We're so lucky and so happy that she's a member of our clinical family. Thank you, Dr. Gibbons. Welcome.
Thank you. Happy to be part of the team.
Oh, thanks. Rebecca Callahan is a women's health nurse practitioner who has moved back to the Princeton area from New York, where she's been working for a number of years. She has training in women's healthcare, and she's a mother of three. Heather Gibbons is a mother of three. Maybe you guys know I'm a mother of four, so we have 10 kids up on the screen represented. And somehow we're all smiling. Maybe it's maternal insanity. I'm not sure. But I think we all feel really blessed and really happy to be able to raise children, raise good, educated children, men and women who are now boys and girls, but and to get to work with the patients we do. I want to bring on Sam and Michaela, who are going to sort of act as our sounding boards and ask us some questions, because it's so much more fun than just hearing us talk and monologue. Hi, Sam.
Hi.
Hi. So I'm really going to be more like a moderator. I'm going to try to be quiet. It's very hard for me, but I will try. Because I want to run through birth control options, both for young women, for midlife women, to talk about birth control around menopause and whether you still need it and what's safe, to talk about some of your concerns, Sam and Michaela, about different options, whether it's experiences you or friends have had, and maybe we can use those experiences to clear up some misinformation or myths, or to shed some light on what might be nice options for people. I'm going to ask Rebecca to start. And Rebecca, I want you to kind of pretend that Michaela has come to your practice and she's asking you about contraception, or maybe Michaela, you just want to ask her, what can I use, so that we can get going a little dialogue about what might be options out there today.
Mm-hmm. So I know the arm implant, a huge perk of it is its permanence, but also kind of seen as a drawback is its permanence, because people wonder, if I'm having negative side effects, how quickly can it be removed? Because it's physically in my body, it's an implant, and that's kind of hard to get out. So how quickly after the implant can it be removed if you're having negative side effects?
Great question. So I think you're referring to the Nexplanon, which is one of the long-acting reversible contraceptive methods, and that is good for up to 3 years. So it's not totally permanent. It is long-acting, but not permanent. So it's just an in-office procedure to put it in right here in your arm, just right under the skin. And you can have it taken out at any time. You just have to go into the office. It's a very quick procedure. Little local anesthesia is put in there, little lidocaine to help with it, and some numbing, and then it's taken out. So if you're having problems with it, there's no problem at all. You can just have it removed, and there's so many other options.
So that's.
Do you want me to go through?
What would be an alternative to that if Michaela isn't okay with that?
Yeah. So there's the other long. If you don't want to get pregnant for another few years or maybe ever, and you might want to look into one of the long-acting reversible contraceptive methods. So the other ones are all IUDs, intrauterine devices. There's one called the Paragard, which is non-hormonal. It has copper It's a copper IUD. All the IUDs are little T-shaped devices that are inserted through the vagina, through the cervix, into the uterus, and they sit up near the top of the uterus. And the IUD, the Paragard, is the longest acting one. It's good for 10 to 12 years, I believe we're saying now. And there's other hormonal ones that are good from 3 to 5 years, 6 or 7 years, depending on which kind you're using. And those are great for teens, for young women, for basically any age, as long as you have a healthy uterus and don't have any infections at the time of insertion.
Mm-hmm. And can we go through the benefits of the copper versus the hormonal IUD?
Sure. Heather, do you want to take it, or you want me to keep going?
Yeah, sure. So basically, it depends on the person and depends on their medical history and sometimes even their family history as to which option they would choose if they're interested in the IUD. Basically, there's the Paragard, which Rebecca was referring to. That's good for 10 to 12 years, and that has no hormones in it. It's a copper IUD. No hormones, and people would pick that one if they had contraindications usually to any hormones. So they may have had a family history of blood clots or a personal history of blood clots, or if they had breast cancer. That's also another common reason we would choose that. And then the hormonal IUD, we have multiple options with that. And as Rebecca was saying, it can be anywhere from 3 to 7 years, depending on which one you choose. And we would choose that most of the time. And that's because they lighten periods most of the time, and sometimes actually take periods all away. And we can talk about kind of why people are scared of that in a little bit, but the real benefit of it is it lightens periods. And so for people with heavy periods as well as cramping, it can significantly change your quality of life and decrease those. So people can, not miss school, not miss work, and significantly changes their quality of life. So many times we would choose that over the copper. And so the downside of the copper IUD, which I found, is that sometimes it can make the periods heavier. And so we really choose our patients very carefully and make sure that they, know that that's a possibility. But again, if they've had breast cancer or a blood clot or they can't use other methods, it's a very good method to prevent pregnancy. And, sometimes the trade-off of a little heavier bleeding may be a benefit to them.
And do we know what causes the difference of some women, when they get on birth control, they stop their period and some don't? Is it estrogen levels that make that difference? Is it something else? Do we know what causes that?
Well, the hormone basically tells your body to thin the lining of your uterus. And so it keeps the lining of your uterus thin all month long. So you're not building that fluffy lining that you need to shed each month. And so that is what causes, the bleeding to be lighter.
But Michaela, we don't know why. If you and I both got IUDs, you might have no period with the hormonal IUD, and I might still have a couple of days. Everybody's a little bit different, and everybody's response to a little estrogen is different. Just like if I put fertilizer on my lawn and you put it on your lawn, my flowers might grow a little taller than yours. So it's not necessarily levels, and it's not something that anybody should go get their blood drawn for or even overthink it. It's really just a response to the hormone released by the IUD. The IUD, one reason I love it is it's all local. It all happens right there. You don't have progesterone going through your whole body. It's just happening right where you need it to happen. So it's tiny, tiny, tiny little doses of progesterone keeping the uterus from growing the cells that you only need to grow that tissue to have a baby. People often think they need to have a period that it cleans their body. That's one of the most common myths that I hear. If I don't have a period, I'm not cleaning my body. Has nothing to do with cleaning, zero. It's just growing a little bed of tissue for an embryo. And if you don't get pregnant, you don't need that tissue. So sorry to butt in. What
Yeah.
else besides, oh, I know. How about some IUD myths or fears? I have patients all the time saying, isn't it going to get lost in my body or travel to my liver or something like that? Is that
One
possible even?
one thing I've heard is that someone said if your cervix hasn't been dilated, then it's very painful to put in. Is that a myth or?
Well, I can address both of those. Um, yes, the IUD can sometimes be placed improperly. And so you definitely want to make sure you have it performed by a well-trained gynecologist or OBGYN. And
Nurse practitioner.
a nurse, yeah, sorry, nurse practitioner, women's health provider.
Mhm.
And so they're T-shaped devices, and so they can't really sneak out the tubes, and they really can't go anywhere. The most common scenario is, and this is pretty rare as well, is that they would come out, they'd get expelled out into the and fall out. That only happens less than, 1 or 2% of the time. Very rarely do they migrate, and that would be usually because they were placed improperly.
Mhm. Yeah. Next question is a good one, though. What about the discomfort? Because I have a lot of patients who won't get it done because they're afraid of discomfort. And I kind of say, well, it's a little discomfort is so much better
Yeah.
than pregnancy,
Yeah,
but
and delivery.
Yes.
I can answer this one if you want.
Sure.
yeah, go, Rebecca.
So what we do in our office at Women's Healthcare of Princeton is we prescribe the patient the night before Cytotec, which is a pill that you can either put under your tongue, or actually we instruct the patients to put it in the vagina, and that can help dilate the cervix a little bit or make it a little bit softer so that the insertion will be a little bit more comfortable for the patient. And then the day of, we instruct our patients to take ibuprofen before the procedure. So that again helps with the discomfort, any pain, any cramping that might be happening during the procedure or after the procedure. And then when you get to the actual procedure, of course, we're going to have you relax, take some deep breaths. You're on the table, and your provider may actually even numb the cervix with some lidocaine. So that can be another helpful step to help avoid discomfort, pain, cramping. I mean, you're still going to feel something, and it depends on your pain tolerance, and also depends on your individual anatomy, how open your cervix is. But generally, it's very straightforward. It's pretty quick procedure. Women feeling a little cramping, kind of like period cramping, and then you have some water, and take your ibuprofen at home as needed, and you're good to go. So it's really not that big a deal.
Is it true that women who have already had children are a better candidate for IUDs because their cervix is a little bit more open or anything like that?
That's a great question. And it used to be thought that you could only have an IUD placed if you had a vaginal delivery. But we now know that's false. We put them in teenagers all the time, and nullips, we call them, women who haven't had babies and any age. And because we have those tools now to help dilate the cervix, sometimes we actually use dilators, which are thin little metal tubes that help start really small. And then if the cervix is really tightly closed, then we put a little teeny one in, and then we put the next size, and that helps it gradually release and dilate, and that helps to put it in.
So better candidate meaning, okay, maybe better because the cervix is already dilated, but that doesn't mean that if you haven't had kids, you're not a candidate or not a good candidate. I think young women who haven't had children are a perfect candidate because, frankly, they get busy, they forget, they move away from home, they're going to college or grad school or their first job out of college, and their pharmacy is still at home. And I'm always getting calls from people saying, can you quickly send me some pills? I ran out. I think an IUD is wonderful for any woman who wishes she had one less thing on her to-do list, because you can put it in and forget about it. And Sam, you can talk about that, right? Because
Yeah,
you want to
for
share.
sure. I originally had been on the pill when I first turned 16. I got on the pill to help regulate my periods. Always had super heavy periods. And then I just forgot about it all the time. I had a busy schedule. I was working and in sports. So I talked to my doctor about getting on an IUD because it was just something I could put in and forget about and didn't have to worry about it. I originally got the Paragard, hoping that the non-hormonal thing would be a great route for me, but because of my heavy periods, it was pretty rough couple months. So I switched over to the Mirena IUD, and I've had that for about 3 years now, and it's been like the best thing ever. Super secure and don't feel like hardly any cramping, just a little bit of spotting every couple months, but I highly recommend an IUD for anybody who is as forgetful and busy as myself.
Awesome.
Yeah.
So we have a question from Ruthie from the chat. She asked, have there been issues with the Paragard IUD breaking, and can you discuss this? Sure. I personally have only had one experience of an IUD that had broken when I had taken it out. And it was really a woman who was about 58 years old, and she had left the IUD in during menopause for 10 years later than it was supposed to be removed.
Oh.
And yeah, so the everything had kind of shrunken down due to menopause, and it was a difficult removal. And even though that did happen, it was very easy to remedy that. So we just took her back into the office and put her to sleep, and inserted a very slender camera that has a little grasper on it. And we were able to grab the arms, no problem. So even if it's very rare that it would ever break, but if it does, we can safely get the rest of it out if we needed to.
Good answer. I would not do an IUD because of that. It's too infrequent and unlikely.
Very rare.
Would you do the same procedure if the IUD got lodged like in the uterine wall?
Yes.
Okay.
Or if sometimes something more common than breaking is the strings disappear.
Yep.
So if we're not able to find the strings in the cervical canal pretty easily, then we would do the similar procedure that I was just describing, a small slender camera called a hysteroscopy, and just grasp the IUD and gently pull it out. And it takes about 1 minute. It's very easy. And the patient's usually sleeping, so they're very comfortable.
Yep. And even if they're awake, we can numb the cervix again, and they don't really feel much of anything. So it's not, again, not a reason not to have an IUD.
Yeah.
I think. I think they are like, God's gift to contraception.
Yes.
I agree.
Yes.
I really do. I just think they've helped so many women. But we should, give fair play to some of the other things. I mean, the pill has been out for over 50 years. It was invented about 53 years ago, and it provides a lot of benefits too. And so I'd love if Heather or Rebecca, one of you guys want to talk about why, what is the pill made of, and how do you take it, and there are very few people who really can't take the pill, but among those who can't, can they take a progesterone only pill, that kind of thing. Who wants to tackle that?
Go ahead, Heather.
Okay. So, basically when somebody comes in for their first birth control talk, we would go over all the hormonal methods that we offer, as well as the non-hormonal methods. And most commonly, we are asked about the pill because, it's the most popular.
Yep.
Yeah. And I think I read somewhere that 13% of all women using birth control in girls, 13% are using the pill. I don't know if you guys know a different statistic, but so very, very common. It's very, people have a lot of friends on it, and so they're more comfortable coming in and talking about that. So, the people who are good candidates, it's pretty much everybody, just like Dr. Sophocles said. If they had a significant family history of blood clots, or had a, scare with breast cancer, personal history of that, then they may want to shy away from the hormonal. But the hormonal options do have great benefits. So it's not only for birth control. So we would screen each patient individually and ask them, how are your periods? How are Are you suffering from any PMS, and are you having any menstrual related migraines? And so we would really go through a thorough history and see if they're a good candidate, and we would discuss all the benefits of the birth control pill with them. It's not just for contraception. So when people hear that, they're pretty happy that they're going to get a lot of additional benefits to than just birth control. And then we go over the side effects. And the most common side effects really we would see is nausea. So we recommend that you would take the pill with food. We recommend you try to take it at the same time every day if possible. And then another common side effect is breakthrough bleeding, especially in the beginning. And this usually levels out. So we never know who the person is going to be. Like your best friend may get breakthrough bleeding and you don't. And the other thing is, not one pill fits all. So sometimes it's trial and error, and we have to go through a couple of different pills to get the one that works right for you. It just kind of depends. And we want to tell people that because they may feel that if they tried one pill, then and it didn't work well, then that they can never use birth control pills. But we have so many different options for them. So if one doesn't work, we encourage them to please come back and to discuss what the side effects were. And then either we can choose a different pill or choose a different method. That answer your question, or do we have extra to the question?
For a smoker, how about for smokers?
Oh.
What could a smoker do?
So a smoker, there's contraindication for smokers who I think it is 35 and above. If you're still smoking, that we would shy away from the birth control pills. And we would pick what?
The combined pills.
Yeah, the combined birth control pills with estrogen and progestin in them. And we would pick one of the other methods, which would be a progestin-only pill or an IUD with or without, a progestin component in it. What else would we pick? Obviously, condoms.
And
then actually, if you want to talk about the new contraception, Rebecca, that I think a lot of people are excited to hear about.
Sure. Yeah, there are two new methods in the past couple of years that have come out, which are really exciting, and I don't think a lot of people know about them yet. I was just hearing about Phexxi recently. That just came out this year. So that is a prescription birth control gel that is really cool because it's on-demand, user-controlled, hormone-free. So what it is, it comes in a box of 12 little pre-filled applicators. And it's a vaginal applicator. You put it in the vagina an hour before sex or less time, within an hour before sex. And you have to put it in before sex. Doesn't work if you put it in after sex. But it changes the vaginal pH so that it stays acidic, and it helps the sperm to not be able to function properly, to not be as mobile. And so it's just, really quick and easy. It's kind of like inserting a tampon before sex. And then if you have another active sex within the same hour, you need another application of it. And it's super effective, 93% effective at preventing pregnancy with perfect use, which is really exciting.
Is that kind of like a spermicide, or would that be something different?
Yeah, it's similar to a spermicide for sure, because how it acts, as working on this level of the sperm, as opposed to working with like preventing ovulation or some other method of action.
Right.
But
The other exciting thing about Phexxi, which isn't official news yet, is that it looks like it also prevents gonorrhea and chlamydia from taking hold and infection. So it may be something that kills two birds with one stone, so to speak, where you're preventing pregnancy and STDs. So I kind of view it as, even if people don't want to use it as their primary, if they want to be on the pill or get an IUD and have really light periods, women could still use this if they were so disposed to use it regularly, so that then it's almost like they have their own condom. They have their own way to say, I'm not going to get pregnant from the IUD, but I'm definitely have a backup pregnancy issue, a pregnancy anti-pregnancy help with Phexy, and I'm going to help myself not get STDs. I think it has a really bright future, and I'm really excited to see how it does in the market.
Yeah. There's also one other new one from last year, the Aloe Vera. Did we want to mention that one quickly? So that one is, you guys might have heard of the Nuva ring, which has been around for a while. It's a flexible ring where you put in for 3 weeks, take it out for 1 week, and then you put in a new ring the next week. That's a hormonal option, estrogen and progestin combination model. So the Aloe Vera takes it a step further, and it's only 1 ring you need for the whole year instead of 1 new ring each month. So it's a flexible silicone ring that you insert into the vagina, and the same kind of situation where it stays in 3 weeks, take it out for 1 week, but then you just clean it off with soap, like mild soap and water. You have it out for those 7 days, and then you put the same ring back in the next month. So it's kind of eco-friendly as well as being really effective, and it's just easier. You don't have to keep going to the pharmacy, and it doesn't need refrigeration, which the Nuva ring asks for. Oops, you're muted.
My cat was meowing, so I had to mute. But I think that's cool because especially people who are away or have a new job away from where their primary pharmacy was, or even if they know they're going to lose their job and lose their benefits, they could get Aloe Vera and have a year of contraception without having to worry about not being able to afford, a pack of pills the next month or a Nuva ring the next month. So
yeah.
I mean, with COVID, I think we have to think like this. There are people who've lost their jobs or their jobs are in jeopardy. So to me, if I was thinking that I might not have the benefit of health insurance, I would either put an IUD in or a Nexplanon or something that would last me for a long time so that I wouldn't have to be worried about that expense.
Great.
Yeah. Michaela, what other word on the street in terms of myths, rumors, problems? What would make you or your friends hesitant to get a pill or an IUD or a ring?
I know some people want to keep their pH balanced. So does continued use of Phexy, can you just use it all the time because it does affect your pH? Is there a limit to how much you can use it?
Good question.
That's a good question.
Yeah.
I don't know, but I don't. It also acts as a lubricant, which is like the icing on the cake. Is that you're preventing STDs, you're preventing pregnancy, and so many women, even young women, complain that sex is uncomfortable, that there's dryness, and so you have a lubricant. So it's really, I mean, unless you're literally having sex around the clock every day, I don't think it's a question most women have to worry about because it's natural ingredients. So it's just going to kind of come out of the body pretty quickly. And that's a great question. I don't think I don't know the data on it long term, but I don't think you have to worry about using it and then having your pH balance be off in a chronic.
Yes.
The vagina
There's
is good at fixing itself like that.
There's just like some of the side effects do include, some people will report some bacterial vaginosis or vaginal discharge. They also haven't studied it on women who have had recurrent UTIs. So if you have a patient who has a lot of UTIs, urinary tract infections, you might want to steer them towards another method. But so occasionally you can have some kind of imbalance, like you said, from that. But I don't think there's like a limit to many times you could use it. And again, every woman's body is different. So they can always try it out. If they have problems with it, they can pick something else.
Great question. She's asking tough ones.
Yeah.
How about perimenopausal women? What about a woman who's between 40 and 50? She's out there dating, or she's divorced, or she's widowed, or she's married, or whatever. And I have many patients who tell me they don't really know if they even need contraception. Do they? And which ones should they use? Rebecca, you want to help us with that?
Well, I definitely would say yes, unless you want to get pregnant. If you're having sex with a man or multiple men, you should be using birth control because even if you're not getting regular periods, you could still be ovulating irregularly. And then if you hit on one of those periods of time when you're ovulating, you can get pregnant, age 50 or something, maybe. Maybe for some women that would be a miracle baby. Others, it would be kind of devastating. So you have to be careful, and you definitely want to stay protected. And especially if you're having new partners later in life, you also always want to use condoms to protect against STIs or the Phexy, like we were talking about.
Yeah, cool. And I have just a quick aside. Now the HPV vaccine is paid for until age 46. So if you're under 46, especially if you're engaging in sex with new partners, do you guys agree it kind of makes sense to get vaccinated?
Absolutely. Absolutely.
So that's kind of news, like we haven't really been able to or been recommending that. We've been worried about HPV vaccination in teens and getting all the teens, and we still should get all the teens vaccinated. But I think this is kind of exciting for the generation of women who sort of missed the HPV vaccine, but now it will be covered with their insurance. I think that's really exciting.
Yeah,
Sorry.
that's awesome.
Absolutely.
Rebecca, any contraceptives that a 40 to 50-year-old couldn't use or shouldn't use?
Good question. I mean, I guess if they don't have any health problems, I can't
think of any.
Think of any that they could. Yeah. A healthy woman, definitely a smoker in that age range can't have anything with estrogen. But besides that, everything it's all in, fair game.
And Heather, can you talk to us about how we use the birth control pill in perimenopausal women, sort of as a Band-Aid or a smoother over transition medication to get them to menopause? Like, how do we do that, and why is that okay?
So quite often we will have patients who do come in and they're starting to have some irregular spotting because their hormones are changing. And so this is very bothersome for them, or they're having more PMS, and we're not able to do hormone replacement therapy in somebody who's perimenopausal. And so, often we will go to the birth control pill or something that's a combined hormone, to help them through that transitional time, to protect them against pregnancy, but also to help with those PMS symptoms, the irregular spotting. Obviously, we make sure that there's nothing else wrong is going on. But if, we have already done that and everything looks healthy, then usually a birth control pill or the ring or definitely an IUD would be great if it's really just bleeding and cramping. But if they're having more PMS, I tend to use birth control pills more often than I would. And then sometimes, we will take away the placebo time if we're using birth control pills or the NuvaRing. In patients that are having breakthrough symptoms during that placebo time where they're having that withdrawal bleed. And so sometimes if they're having breakthrough headaches or horrible PMS symptoms, we will, can do a continuous type of hormonal control for them.
What about if you want to control when your period comes because you have a wedding coming up or you're going away to the beach or something like that? Michaela, have you ever heard anybody ask for that or do that?
Yeah.
Right? Sam's not.
Yeah, I used to, my friends and I would do that in sports. Like if we had a big game coming up, we'd be like, oh, let's try and skip this one or something like that.
So how would you do it? How would you do it?
We would, if we were taking birth control pills, the placebo week, we wouldn't take the pill and we just keep taking birth control pills into the next month. So like open a new pack and take those the week that should have been our period.
All right. So Sam's a budding gynecologist. All you have to do is not take the placebo pills, and you don't have what's called a withdrawal bleed. You don't stop the hormonal part that's supporting and keeping everything happy. It's when you take the sugar pills that you signal to the uterus to have a bleed. So Sam and her friends figured that one out, and that's a super easy thing to do. I don't think you can really do it indefinitely because I think eventually things want to shed, but you certainly can do it for a number of months, right? Any last questions? Because I don't want to take up any extra time, and I know people want to get going and enjoy their evening, and I try to keep these little gynecologist things short and sweet so we don't bore people. But anybody who has questions, who's listening, you can contact Dr. Gibbons or Rebecca or myself at princetongyn.com on our website, or come visit us if you want. And we are going to have we have lots more of these. We're going to be talking with Dr. Mary Jane Minkin, who is a riot and also a very smart lady up at Yale on June the 3rd. Her pseudonym is Madam ovary
Ah,
on Madame Bovary, and she's really wonderful. So I hope you guys will watch. I sure will be there. I get a kick out of her, and I learn from her absolutely every time I talk to her. I really want to thank Rebecca Callahan and Heather Gibbons, two super, super clinicians and super bright women that I am so lucky to work with. And I want to thank Sam and Michaela, because lucky me, I get to work with you guys too, kind of behind the scenes. And I really, really appreciate you all taking this time. Any closing comments? Anybody have any last questions or things they want to add? Did we forget anything? Condoms?
I had a quick question.
Patch.
I know beforehand we kind of talked about birth control pills decreasing ovarian cancer risk.
Yeah.
Does the IUD also do that, like the hormonal IUD?
No,
Okay.
because they decrease the risk because they stop ovulation. And there's a theory that when an egg ovulates, it ruptures out of the ovary, and it's like a little tiny injury. And if you do that 70 times in your life, it's 70 times that the ovary has to repair. It could repair incorrectly and begin the process of ovarian cancer. So the ways to reduce your risk for ovarian cancer are to be on the pill so you don't ovulate as much, and or to have children, because when you're pregnant, you don't ovulate for the whole pregnancy. So we know that women who never have children have a higher risk of ovarian cancer than those who have children. And we believe it's because when you're pregnant, you pause that ovulation. IUD does not do that. So
Okay.
it will not. But if you've been on the pill, even for a few years, you've already gotten that benefit.
But just to add to that, the IUD does decrease your risk of uterine cancer.
Right.
So since it thins the lining out all month long and keeps that thin, it does protect against uterine cancer. And
Right.
sometimes we use it for that reason.
Right.
Yeah.
Right.
Thank you.
So do a little of each, just like you're doing, Sam.
Right.
All right. Thank you so much.
Okay.
Everybody
Thank you.
Thank you.
And I look forward to seeing you all again. Take care.
Yep. Have a great night.
Awesome.
Thank you.
Bye.
Bye-bye.